responding to transition. So some individuals, for example, have a one-on-one aide that's with them for years. And all of a sudden they're finished with school and they no longer have that aide. And that is a very difficult transition for someone to deal with, and the individual may not be able to articulate or may not even really be aware of those emotions. And these are the things that can unfortunately lead to symptoms of depression and anxiety. And we see depression and anxiety in higher rates in individuals with epilepsy, those that are functioning within normal limits, as well as those with intellectual or cognitive disability. We also want to encourage the adolescent to set positive, realistic goals. So we want to make sure that what they're wanting to do is something that they're actually going to be able to do, so that we're not really setting them up for disappointment later on. And we want them to have a supportive network of friends and family. We want them to participate in as many things as they can, whether it's sports, whether it's other type of activities through church, just really help them so that they have a sense of support, not only from the parent, but from friends and other family members. So in conclusion, transition essentially involves the development of self-management skills it's normally associated with positive medical outcomes. Key components to transition involve awareness and knowledge of the medical condition, understanding the rationale behind a therapeutic regimen. So the individual or the adolescent, young adult, really needs to understand that you are prescribed this medication and this is what it does. Alternatively, they also need to understand the consequences of choosing to follow a regimen of their own choosing. So, like we heard from Dr. Sheff, what's the consequence of tweaking your medication? What's the consequence of not taking your medication? What's the consequence of getting inadequate rest? What's the consequence of using illicit substances? All those things are things that they need to have an awareness of, and they're discussions that we need to have, even though they may not always be comfortable, because they can have serious ramifications if we do not. Also, for most individuals, even though there is some apprehension and insecurity, moving on to the adult care is usually a welcome and positive challenge for both the young adult with a chronic medical condition as well as their parents, again, despite inherent insecurities. It usually takes a while to get accustomed, but once they do, they realize that it's really not so bad. And here's a quote that I thought really captures transition and what it means really well. It says that transition should never be considered a sprint, a baton pass, or simply the event of transfer between pediatrics and adult care. Transition is in reality a marathon starting on the day of diagnosis. And I just have some resources here. There are some excellent resources to help with the process of transition. There's the National Healthcare Transition Center, Jack's Hats, which is here. That's a really wonderful service. CMS, the ARC, they help quite a bit with guardianship, and they help with securing funding and helping figure that out. And they have a really nice publication called A Path, which really illustrates all the issues involved in guardianships and what the different level means and how would you go about doing that. So there really are some nice resources that are available. Okay, well, that's it.
Thank you very much, Dr. Cox. Well, I think you get the prize for the one that is the most punctual, finishing up right on time.